So, for the assessment of the musculoskeletal system, you would start off by doing an inspection. And when you're doing the inspection, you want to look for the posture, swelling, symmetry, redness, any atrophy or bruising. Atrophy is when the muscles don't get used, so they become weak, and when they atrophy completely, you can't put pressure on them, you can't put resistance on them, which is why it's important for people to constantly use their muscles. You see atrophy a lot in coma patients, any patient that's bedridden, which is why in the hospital they get PT in as much as they can to get them up and moving, because you don't want muscles to atrophy. After you inspect, you would palpate, and you just want to palpate for pain, any masses, edemas, spasms, and palpation is very, very important. And often when it is skipped, especially in children, you miss the diagnosis of bone cancer, which can be extremely, extremely serious. And the only way to have a hunch of bone cancer is to palpate and feel for any pain, any tenderness, temperature of the skin even, because usually redness, pain, and warmth can indicate something's going on in the bone. Like Irving's sarcoma or something like that. That's how it can start. And you would also want to inspect their gait. When they're walking, are they walking straight? Are they kind of slouching to one side? Does it look like one hip is higher than the other? These could all be due to different syndromes, such as scoliosis or something like that. So it's very important to inspect the gait as well. Then you would want to move on to their posture, which you could check for scoliosis, lordosis, kyphosis, and this is just by bending down, feet together, and bending down to touch your toes without bending your knees. And you want to see if the spine is straight, or if maybe on one side you kind of see how like the rib cage is up further, which could indicate a curvature of the spine. Kyphosis is more when you have a hump on your back, so you can physically see a bulging almost in their back. And then lordosis is when it curves in instead of around. Like scoliosis, lordosis is when it goes inwards, which you can also see by standing straight. And then you would want to check their muscles. So when you do this, you want to check against resistance, and you can grade this from a 0 to a 5, and 5 being normal, that they have full resistance. What you can do is, when they make a muscle, you kind of pull back, and if you don't see any flinching, any spasms, you don't see anything and they don't move or anything, it's a 0. And then when it's a 5, it's when you see the muscle flexing, you see that their arm is physically doing something, whether they win or not, pulling against your resistance, either way, but you can see the actions taking place in their muscles. That would be a 5. When you can see that they're against gravity, like when there's no resistance, but you can see their muscles moving and they're able to move it and form a muscle, that's a 4. So you want to use the scale and determine what their muscles are with resistance. And you want to compare both sides. Is the right side stronger or weaker than the left side? Because when you atrophy, you can atrophy on one side. You don't have to atrophy on both sides. But you do want everything to remain symmetrical, which is why if you test one side, you have to test the other side. Range of motion, you want to test because you want to make sure all the joints are still functioning. Muscles that connects the joints and things like that are still functioning. So you can do range of motion for the neck, looking up, looking down, side to side, just rolling their head. Same thing with their arms, wrists, ankles, knees, hips, any joint really you can rotate for a range of motion. You would then go to the straight leg test, and the straight leg test is just the patient is laying supine, and they just raise their leg. Their leg is straight and they raise it, and you want them to raise it as far as they can go without feeling pain. You don't want them to feel any pain. Even when they raise it as high as they possibly can, you don't want pain. But if they do feel pain, you want to know at what degree that they've lifted their legs. The pain would be more in their back, so it would be back muscles causing the pain. So that is important to look for. Then the Fallon's test, which is a test for carpal tunnel syndrome, which is in the wrist. It can cause pain in the wrist. And what you do is you place your arms on on a table, and you put the back of your hands together, and you want the patient to hold it for about 60 seconds, and they shouldn't feel pain. They should be able to do it without shaking, without pain, tingling, sharp pains, numbness. This is for carpal tunnel. And then Tinel's test is when you want to test the medial nerve in the wrist, and you just percuss over it like that, and they shouldn't note any tingling, numbness, or anything like that, which if there is, again, it could be carpal tunnel. The bulge test is when the patient is laying down, and you take the ball of your hand and you kind of, if this was the knee, you kind of rub it straight up the knee, and if you feel a displacement, like the movement of fluid, then that could indicate something along the lines of a meniscus issue, because there shouldn't be fluid there and definitely shouldn't be moving like that. So it could mean something's wrong with the meniscus. The Ballotman's test is when you are still laying down supine, and with your non-dominant hand, you kind of, like this, you grip their patellar and kind of hold it in place so it's not sliding. And with your other hand, you push down on the patellar against the femur, and you want to push down against the leg, so you don't want to feel any movement. You don't want it to move, and if it moves, if it slides, it could be a meniscus, it could be something definitely wrong with a ligament or a muscle of the knee. So you want to make sure to do that. The McMurray's test is when the client is lying supine again, and you bend the hip and the knee, and you hold the knee just like you did for the Ballotman's test, but you also stabilize the heel, and you rotate the leg in and out, and you also straighten out from the knee up. You straighten it out, and you don't want to feel any clicking or pain of any sort, like in the back or in the hips, so you don't want to feel any of that. And then is the Lachman's test, and that is when you hold the femur, and you're on the tibia also, and you pull the tibia, kind of like this is your femur and this is your tibia, and you kind of pull the tibia up and down, and this is testing for the ACL, and it should stop. Like, you shouldn't be able to really move it. If you can really move it and you don't feel a notable like pull, then the ACL is torn. But if you can feel that resistance where it's telling you stop, then the ACL is intact. The posterior drawer test is when the foot is stabilized and you push back on the tibia, and This is for a PCL tear, and when you push back on the tibia, it shouldn't be like a big gap almost when you push back. It should kind of align still with the knee. The tibia shouldn't be pushed further back than the actual kneecap. It shouldn't go past the kneecap. So if you do see it go past the kneecap, then the PCL is torn. It shouldn't really have that big of a movement. The valgus test is, so it's for the knee, and you push down on the outside. You push down, so when you're laying on the knee, and when you're laying down straight and the leg is straight out, you kind of hold the leg below the knee, and you push from the outside of the knee inward, and this is testing for MCL, and you kind of want to see how far the kneecap moves inward, medial, because it shouldn't, like any test, shouldn't be a significant drift in. And then the varus test is the same thing, but you bend the knee, you push from the force, you push a various force into the knee from the outside inward, and then you straighten out the leg, and you push on the sides, and any major shift is indicative of an MCL tear as well. So that's it for the musculoskeletal system.